to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It's also sponsored by Comfort Care and Hospice-related services throughout the entire DFW Metroplex. My name is Dr. Paul Cespedes. I'll be co-hosting today's show with Dr. Vik Prakash. We have a lot of great shows coming up in the next few weeks. You can look us up again on doctalklive.com. Also check out our YouTube channel, Doc Talk Live. Like it, comment, and let us know what topics you want to hear. We have a quick announcement here. We've been talking about this for a few weeks now. Dallas Renal Group is partnering with the Texas Kidney Foundation to host a free screening event on Saturday, November 11th at the Central YMCA in Arlington. The event is free and open to the public from 9 until 4. It only takes about 30 minutes to get screened for kidney disease and talk one-on-one with a medical professional about your results. Be sure to bring your friends and loved ones for this free screening. Again, it's on November 11th at the Central YMCA at 2200 South Davis Drive in Arlington, Texas from 9 a.m. until 4 p.m.
This is Dr. Vik Prakash, your co-host of Doc Talk Live. Today, ladies and gentlemen, we have a great show for you all. The topic that we're going to be discussing affects millions, and it's become an alarming health concern for many. This disease can lead to other problems, which makes it even more detrimental to have. Together, we can change the increasing amount of individuals affected by this disease and achieve lasting improvement that will lead to greater health, productivity, and cost. That's why today we'll be discussing hypertension, and we have Dr. Anne Chacko and Dr. Salman Raheem in studio with us. To be part of the conversation, give us a call at 972-235-5555. Again, that number is 972-235-5555. We'll be happy to take your questions throughout the show. Dr. Chacko, Dr. Raheem, welcome to Doc Talk Live. Thank you so much for volunteering your time to be a part of the show, and tell our listeners a little bit about yourself. Dr. Chacko?
Thank you for having me on the show. My name is Dr. Chacko. I work in Medical City, Dallas, and I've been in the Dallas area for about 5 years now.
Hello everyone, I'm Salman Raheem, and I'm a board certified internal medicine physician and teaching faculty at Methodist Dallas Hospital. I grew up in this area and have been practicing medicine for about 3 years now. Thank you for having me on the show.
All right, welcome to the show, Dr. Chacko. Welcome back. Our first question goes to you. So according to the CDC, about 1 in 3 adults has hypertension, high blood pressure, and only about half of people with high blood pressure even have it under control. So can you tell us exactly what is hypertension and why is this a problem?
So blood pressure measures the pressure in the blood vessels when the heart beats. It is measured as a fraction. The top number is the systolic blood pressure, and it measures the pressure when the heart is beating, and the bottom number is the diastolic number, and it measures the pressure between heartbeats. So a normal blood pressure is with a systolic less than 120 millimeters of mercury and a diastolic less than 80. You're considered to be in pre-hypertension when your systolic number is between 120 and 139, and your diastolic between 80 and 89. And numbers above that are considered hypertension.
We've got our first live call. Let's take it. Hey, welcome to Doc Talk. What's your question for our expert? Dr. Raheem?
So there is no direct correlation between vitamin B12 and vitamin D that we know of, but a little bit later on in the show we're going to discuss some of the other medications that can drive your blood pressure up.
Dr. Raheem, what is considered a normal blood pressure and what causes high blood pressure?
Before I get into the definition of that, I just again want to reiterate what Dr. Chacko said. You're going to be hearing about a couple of numbers. Again, the first one will be a systolic blood pressure and the other is a diastolic blood pressure. Normal blood pressure is usually a blood pressure that's less than 120 over 80 millimeters of mercury. Most adults with hypertension have what's called primary hypertension, which means that the cause of the high blood pressure is not known. A small number of adults have secondary hypertension, which means that there's an underlying and potentially correctable cause, usually kidney disease or a hormonal disorder.
Can anyone get high blood pressure, or what populations may be more likely to have high blood pressure?
Anyone can develop hypertension, but certain population groups are at higher risk, and these include older adults, folks with family history of hypertension, obese folks, diabetics, folks who smoke, have an inactive lifestyle, and those who consume high amount of salt in their diet, and folks with excessive alcohol intake.
All right, folks, you're listening to Doc Talk Live. We are discussing hypertension, a very common disorder. So please call in with your questions. The number to the studio is 972-235-5555.
So, Dr. Chacko, Dr. Raheem just mentioned a few things that people may take that cause high blood pressure, like high salt, alcohol. What would some of the symptoms of a high blood pressure be?
So if your blood pressure is high, you can have several symptoms that you can be on watch out for. One of them is you get a headache. Some people feel weak on one side compared to the other. They have blurry vision, stuff like that.
Let's take some more calls. Hi, welcome to Doc Talk. What's your question? Dr. Chacko?
Yes, if you have a family history of hypertension, there is a greater risk that you can get it. But again, with exercise, good diet, especially a low salt diet, you can control your risk factors so you're not you don't get it.
Let's take another one. Hey, you're on the air. What's your question? Dr. Raheem?
That's a very good question. We were actually going to talk about the stages of hypertension, so I think this is a good lay-in into that question. We do realize that many people are anxious when they're seeing a doctor or a nurse, so we don't diagnose hypertension the very first time you come into a doctor's office. It's usually after 2 office visits, at least 1 week apart. But there is an exception to this, that is if you have high blood pressure and are symptomatic and have problems such as heart, eye, or kidney disease, that you are diagnosed with blood pressure. Talking about the specific question, there is something called pre-hypertension, which is where your blood pressure is between 121 to 139 over 81 to 89. People with pre-hypertension are at increased risk of developing hypertension and heart-related complications. That's why this is important. Now, hypertension itself has 2 stages. Blood pressure of 140 to 159 over 90 to 99 is considered stage 1 hypertension, and a blood pressure over 160 over 100 is considered as stage 2 hypertension.
Hey, you're on the air. What's your question? Oh, we're actually doing a Doc Talk live show right now. Call back later. All right. And Dr. Raheem, what are the treatment options for hypertension, and can hypertension ever go away without any medical treatment?
As Dr. Chacko mentioned earlier, treatment of hypertension usually begins with lifestyle changes. Your doctor might tell you to reduce the amount of salt in your diet, lose weight if you're obese or overweight, avoid drinking too much alcohol, stop smoking. That is a big one there, folks. And exercise at least about 30 minutes regularly. And there are medicines to lower your blood pressure, but these are recommended if your blood pressure is consistently over 140/90, even after lifestyle changes.
Got more calls. Hey, you're on the air. What's your question for our experts today? Hello? Sure, go ahead.
Sleep apnea is a known risk factor for hypertension. Therefore, you've heard us talk about losing weight and monitoring your diet. That ties in with sleep apnea as well, because that would be one of the benefits, as in losing weight would be benefits of treatment of sleep apnea, and that in itself will help with your hypertension.
Let's take another call. Hi, you're on Doc Talk. What's your question? Yeah, go ahead. Sure, that's a great question.
I'm not sure of the sodium content of each of the salts. So when you buy a salt, if you look at the label and see exactly how much of sodium is there, you buy the one with the least sodium, and you can use it. The thing is, when you cook, you should use as little sodium as possible, and after the food is cooked, refrain from adding more salt to season the food before you eat. So that's one way to control the sodium level of your diet.
Let's take another call. Hey, you're on Doc Talk. What's your question? Fantastic. Dr. Raheem?
It is called silent killer because hypertension is a risk factor for multiple diseases. Heart disease, eye problems, kidney problems, stroke, to name a few. And it is a contributing factor to all of these mentioned diseases.
And just to add to what Dr. Raheem said, you might not have any symptoms of hypertension. So your blood pressure might be very high and you're not feeling anything. And so that is another reason why it's called a silent killer.
All right, we've got a minute left. Let's take one more call. Hi, you're on. Oh, if you could turn down your radio, you're on Doc Talk. What's your question? Okay, great question. We're about to head into our break. A lot of callers came in at once, so if you didn't get through, keep calling. We'll catch you during the break. Number to the studio, 972-235-5555, discussing hypertension.